Ever felt like everyone is watching you, or perhaps the police are after you? This feeling can be more than just a fleeting sensation of discomfort. It can be a symptom of a mental health condition known as paranoid delusions. Paranoid delusions are a form of psychosis, where individuals hold on to false beliefs fervently, even in the face of contradicting evidence. These beliefs often revolve around the idea of being persecuted or targeted by others. The symptoms of paranoid delusions are quite distinct. An individual may feel constantly watched, followed, or targeted. They might believe they are the focus of a conspiracy or that others are plotting against them. These feelings can be so intense that they interfere with daily life, causing distress and isolation. But it's important to note, these symptoms alone don't necessarily point to paranoid delusions. They could be signs of other mental health disorders such as generalized anxiety, depression with psychosis, schizoaffective disorder, or schizophrenia. Generalized anxiety disorder, for instance, might cause a person to worry excessively about everyday situations. However, unlike paranoid delusions, these worries are usually not focused on persecution or conspiracy. On the other hand, depression with psychosis involves not only feelings of intense sadness and despair, but also hallucinations and delusions. Yet, these delusions are often self-deprecating, not paranoid in nature. Schizoaffective disorder and schizophrenia, however, can present with paranoid delusions. These conditions involve a mix of symptoms including hallucinations, delusions, disorganized thinking, and emotional flatness. Diagnosing these disorders requires a comprehensive evaluation, including a detailed medical history, physical examination, and mental status examination. The clinician might also use specific diagnostic criteria, such as those outlined in the Diagnostic and Statistical Manual of Mental Disorders. Once a diagnosis is established, treatment can begin. This typically involves a combination of medication and therapy. Antipsychotic drugs are often used to manage delusions and hallucinations. These medications, however, come with potential side effects, so it's crucial to discuss these with a healthcare provider. Therapy, particularly cognitive behavioral therapy, can also be beneficial. This form of therapy helps individuals understand and challenge their delusions. It provides them with strategies to manage symptoms and improve their quality of life. There are also newer approaches, like metacognitive therapy, that help individuals to distance themselves from their delusions and develop healthier ways of responding to their thoughts. In summary, paranoid delusions are more than just a feeling of being watched. They are a serious mental health condition that requires professional help. It's crucial to recognize the symptoms and seek help if you or someone you know is struggling with these feelings. Remember, treatment is available and recovery is possible. So the next time you feel like everyone is watching you, pause for a moment. Ask yourself, is this a fleeting feeling or a persistent belief? If it's the latter, don't hesitate to reach out for help. It's the first step towards understanding and managing your experiences better. Remember, this video is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have watched in this video. Your health is important, and while we aim to provide useful information, nothing can replace a one-on-one consultation with a healthcare provider.